For the CNS and PNS, we have different parts of the brain that you need to be able to recognize, okay, from a variety of views, okay? We have our different cerebral hemispheres, which we'll take a look at. Let's look at this side view first. We can see the different lobes, frontal lobe, parietal lobe, occipital lobe, temporal lobe. We can see cerebellum, and we can see the brainstem, pons, medulla oblongata, and deep to this would be the midbrain. We can see the central sulcus, okay, separating out the frontal and parietal lobes, and we can even see precentral gyrus and postcentral gyrus on either side of central sulcus. We can also see the lateral sulcus here, separating out the frontal and parietal lobes from our temporal lobe. And we can see the parieto-occipital sulcus, separating out the parietal lobe and the occipital lobe. All of these lobes together make up a structure we know as cerebrum. And we know that cerebrum has a variety of convolutions or ridges called gyri, and all of these minute depressions are called sulci. This is what this would look like with a cadaver brain, very same structures. You will also have to know a number of different structures, including the cranial nerves. The cranial nerves are not ID'd here specifically, so we're going to actually go through that together on another picture. All right, we have a kind of view of the brain here. We have a number of different internal structures for the brain that we'll take a look at. Mostly for diencephalon, you just need to know the thalamus and the hypothalamus, thalamus being here and hypothalamus being here. For cerebellum, you'll see arbor vitae, which means tree of life. That's this white matter here. And then the surrounding structure is the cortex of the cerebellum. Brainstem, we can actually see the midbrain now, midbrain, pons, medulla oblongata. And that is about it for most of the features until we start to actually look at some of the spaces in here. Again, this would be another view with the cadaver brain. For our ventricles, you do need to know those structures. We have our two lateral ventricles, left and right. We have interventricular foramen, the hole allowing it to flow from the lateral ventricles to third ventricle. We have a canal here called cerebral aqueduct, allowing CSF to flow from third ventricle to fourth ventricle around the brainstem. Those are just some different views, right? We've got the two lateral ventricles, also called the lateral horns. We have interventricular foramen. We have third ventricle, cerebral aqueduct, fourth ventricle from these different views. We have precentral gyrus, which is in front of central sulcus. Don't worry about knowing the rest of this information here. We have postcentral gyrus going behind central sulcus on the parietal lobe. Don't worry about this extra information here. As far as the brainstem goes, you don't have to identify any specific structures on it, just the main three: midbrain up here, pons right here, and medulla oblongata here. You'll notice there are a number of cranial nerves, which we will see a different view for, so you can learn those as well. Again, these are just multiple views of the same thing. For cranial nerves, you will have to be able to identify them in a very similar picture to this brain right here. The cranial nerves are highlighted in yellow. There is a specific exercise that you can actually do to go through your cranial nerves. It's a little dance of sorts that I usually do. I can show you guys that real quick. Essentially, you're just kind of trying to follow your cranial nerves as best as you can through just doing these kind of hand motions. Let me see if I can get my camera to focus real quick. Let's see. I think you can see me, although that's super close. Okay. And you may be able to see me kind of in the picture. You may not. Okay, so I'm going to stop sharing real quick so I can be on the main screen. Okay. So as you go through the cranial nerves, and you'll want to see kind of the picture. So let me see if it'll pop my head up in there with the thing. Yeah. So my head is in view. So as you go through the cranial nerves, you can see they're oriented a certain way, and they all kind of go throughout the midline of the brain into different sections. And a lot of them just kind of go around the brain stem once we start with cranial nerve 3. Okay. So what I usually do is this is 1. Okay. We can see the 2 olfactory nerves. This is 2, right? They make that optic chiasm for cranial nerve 2. And then we start on the brain stem 3, 4, 5. And I just do my branches of 3 for 5 because it's our trigeminal nerve. We then go back to the middle 6, 7, 8, 9, 10, 11, and then 12 is back in the center as we go through. So we do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 back in the center. We're just doing motions to go around what we're doing. I'm gonna I'll continue with myself in view as we look through these pictures. All right, so cranial nerve 1, right? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and then 12 is back in the center. So they kind of all just kind of go in and out. You just need to know when to stop and where to stop. So 1, 2, 3, 4, 5, back in the center, 6, 7, 8, 9, 10, 11 is kind of long, right? And then 12 back in the center. So kind of memorizing how they orient will help you when you're labeling them on the exam.